Hey guys, welcome back to my channel. It's Nurse Gabe, and in this video, I'm going to give you guys my 1 year update as an ICU nurse, as well as some tips, and I'm going to dive into my salary. I'm sure you guys are excited about that part. All right, so going into the ICU, originally I was excited. I was a CNA prior to that, and seeing the job, I knew what it took to be there. Um, but being on the nurse side of it, it is much more overwhelming, and it's a very high pressure, and it can be chaotic at times. And I've had the opportunity to care for cardiac arrest patients, post-op patients, DKA, HHS, AKI patients, patients battling sepsis, patients with respiratory failure, and patients who just suffered strokes. So it's a wide range of diagnoses in the ICU, and a lot of them are critically ill and unstable. I've also had already dealt with codes. And it's very, codes are, can be, they could go one of two ways. You either have a team that's very organized and on top of it, and they could critically think, and with those situations, you're usually gonna have a good outcome and get the patient back. And I've also been in situations where we didn't get the patient back, um, even with like relentless resuscitation. But um, sometimes that's just how it goes. Um, Going along, I've also had the opportunity to deal with um, comfort care and end of life care. With that, you get to learn that compassion is the most important thing. You're dealing with a family and you're having to help them get through the most difficult time in their that could be in their life. So compassion is probably the biggest takeaway when dealing with end of life care. And I've also learned that life is very fragile, and you know you got to make the best out of every day. Okay, moving along, I want to give you guys some tips. So number one is that you want to be resilient. Um, you're gonna be seeing some things that can. It's this job is very emotionally heavy as well as physically, but it can be emotionally heavy, and so you need to be resilient as well as you need to learn to cope with things. What I do, and along with my coworkers, we usually get breakfast after, and we could just talk about how the shift went. And then exercise is also something that helps me. I like to work out in my garage and just run miles around my neighborhood. So tips for the job itself is to be organized and be organized right away. Like as soon as you're getting a report, you want to make sure the medications are running the drips, that they match the rate of the medication matches what the outgoing nurse is saying. And then you also want to put eyes on the line, trace them to the patient, make sure it's being administered through the accurate IV access, as well as that it's actually connected to the patient. No signs of infiltration. You want to look at the medication, make sure there's enough volume in there that will get you through you assessing that patient and the next patient, that it won't run dry. You also want to put eyes on the monitor. Like there's been a situation where I walked in and the monitor was set to Q4-hour vital sign checks, and that is not okay. Especially if they're like on a pressor medication, that should be 15 or however much. That's for our facility Q15 checks, but a lot of them it should be 30 to an hour. Um, so that's something, just be very organized at the very beginning of your shift. Um, Another thing is you want to have good communication skills with your coworkers and with the physicians and with the specialist, with all the ancillary staff as well. Just great communication, it goes a long way. Another tip is going to be to rely on your team. The ICU and nursing in general, it's a team job. So a lot of times I have a question, and when I very first started, I had a question, and I was like, okay, let me figure it out. And it is fun to troubleshoot things, but you'll learn to rely on your team, because a lot of times someone has already dealt with a very similar situation or this exact same, and they already know the answer, and they could just easily show you and teach you, and you'll save time and frustration. So use your team and ask questions. Um, all right. And then the salary. All right. So I started in February of 2024 in the ICU. I originally was placed on day shift and then eventually transitioned to night shift. I felt that was a better fit for me. So from February for that entire year, I made about $80,000. Um, I'm sure there's ICU nurses making over $100,000 or more. You can make more with more years of experience, maybe adding more credentials, another degree, BSN and MSN, also like CCRN, those type of credentials. And then if you're a traveling nurse in the ICU, I'm sure there's those nurses are making over 100 grand right now. But money isn't everything, pay isn't everything. It's a big part, but it's not everything. You also want to focus on like job life balance, as well as like benefits and job satisfaction. All right, so this is my update. Also, let me add that I do plan to go back to school to get my BSN at Western Governors University, and I have started studying just a little bit for my CCRN, the Critical Care Registered Nurse. I've been using materials like this. Um, so this is Barron's study material. Got it from Barnes and Noble. Just started studying into it, but I do plan to take that as well. But yeah, this is my 1 year update. I'm excited what the future holds for me. And if you guys have any questions, please comment and also please like and subscribe and please share this video with future nurses and nurses alike and people that would just enjoy this content. All right, see you guys in the next one.